A crisis at area hospitals with more COVID-19 patients taking up beds than any other time during the pandemic. Thanks for joining us. I'm Jamie Tompkins.
And I'm Matt Lorch. And just when it seemed like the darkest days of this pandemic were behind us, for doctors, nurses, and other healthcare workers, things are as dire as ever. Q13 News reporter Hannah Kim leads our coverage live from the newsroom. Hannah?
So Jamie and Matt, the latest data shows there are 1,240 people with COVID in hospitals across Washington state. That is in fact higher than the previous record of 1,100 in December. This data is coming from the Washington State Hospital Association. They say rate of hospitalizations started increasing in early July, and it's doubling about every 2 wees.
Hi, how's it going? You doing okay? Hi, nice to see you.
Hospitals across Washington are running out of room. People so sick from COVID are stretching hospital resources and stressing healthcare workers on the front lines. For example, UW Medicine says as of Friday, they have 82 COVID patients hospitalized across their network, including Harborview.
Well, it's surprising because I know our area is one of the highest vaccinated, areas.
This West Seattle mom says one of her family members recently contracted COVID despite being vaccinated.
When we got the results back, it was super surprising that it said the virus was detected.
Doctors say the Delta variant is leading to more breakthrough cases, but vaccinations are still the best prevention from landing someone in a hospital bed.
Despite our community having a reasonably high vaccination rate, the 30% of people out there that are unvaccinated are driving the development of variants. They're the people that are coming to the hospital.
Dr. George Diaz with Providence Regional Medical Center squarely putting the blame on the unvaccinated, who are not only helping to spread the Delta variant, but they make up the majority of those hospitalized.
The unvaccinated are applying a lot of pressure to our hospital just based on people coming in. And not only are the numbers high, the types of patients that are coming in the hospital are different.
They are seeing a big jump in hospitalizations among the young, more than before. At this point, Providence and Everett is at 99% capacity, with half of all their ICU cases amounting to COVID.
Our staff is frankly frustrated and about what's going on now. They can look out the window and see that the people protesting against vaccines outside can't see what's happening inside the building, which is very sick people on oxygen in the ICU.
People who have been hit by the aftermath of COVID say it doesn't have to land them in the hospital for them to realize the situation is serious.
It becomes very real. You can pretend like it's not real until you can speak to someone who's been directly impacted by it.
Now, Dr. Diaz says healthcare workers are so burnt out that some of them are leaving. And because they are so stretched, hospital systems are once again delaying non-emergency surgeries. In the newsroom, Hannah Kim, Q13 News.